Hi everyone, welcome to this week's video. I have a few topics that we're going to talk about tonight and I'm really excited. The first thing that I want to talk about are my test results. So, my PCR did come back elevated. We weren't all that surprised. Last month it was, 0.09%, and we were kind of expecting it to hit that 0.1% threshold. And I did. In fact, I actually passed it a little bit. My PCR ended up being 0.20735, something like that. So I haven't heard from my team yet, but we are kind of expecting that I am going to have to go back on chemo. Again, I'm not really upset by this. It was told to me that it was a 50-50 shot, and it was pretty likely that I would have to go back on. From reading around in different groups, I'm kind of seeing the same theme, that some people were off their TKI for maybe 3 to 6 months, and that's kind of where I am. I'm right in the middle. I've been off since December, so it's been about 4 months. I was hoping to get 6 off chemo, but it doesn't seem like it's going to go that way, but you never know. I will update when I hear from my team finally. So that's the update on my PCR. Everything else in the CBC was normal. This week on Wednesday, I'm going to Connecticut to have the nerve conduction study done on my legs to figure out if I have any issues with my peroneal nerve behind my knee, figure out what causes the weakness in my foot and leg. So that's the story with that. Now the question that I'm going to be talking about this week is how I stay safe while riding the ambulance. So a few weeks ago I was wearing my uniform for one of the videos. I do ride for my town's ambulance corps. I'm not an EMT yet, but I am training to be, and I love it. I've been doing it on and off for 6 years, and when I got the CML diagnosis, I was really upset because I thought I was going to have to give it up, but I made a deal with my team, to take precautions, and this doesn't go for everybody. Everybody is different. For me personally, my white count was never low. I was never truly immunocompromised, so it wasn't really, I don't want to say that big of a deal for me, but it wasn't as, I guess, limited as I thought it would be. The only requirements that I really had, and this was before COVID, this was about 3 years ago when I rejoined the ambulance after my CML diagnosis. I was told to wear a mask when there was any possibility of interaction with bodily fluids, or, if a patient's coughing or has a respiratory infection. I was told that I should wear a mask. And of course, in training they teach you in bloodborne pathogens and everything that you have to wear gloves. So obviously that's always a must. Now, some people were wondering, in addition to that, how am I still riding during COVID with CML? So, this is where I get to bring out some of my toys. So, I got these goggles, which actually do help. Unfortunately, I had a cardiac arrest call a few weeks ago. So, these are really important to wear because you never know if there are going to be any fluids or anything coming out of the body when you're doing compressions or any other care to the patient. And then the other piece of equipment I use is this respirator. So this goes over my head. I guess I'll put it on. So it goes over my head, and it has the 2 filters, which keeps your air clean, and it's great because you don't really smell anything. So, if a patient is sick or, vomits or whatever, you don't really get bothered by it. It is a pain to wear, but it does do the job. So with that said, and my white count not being too bad, my team doesn't really have an issue with me riding. They kind of leave it up to me as a judgment call, and I take precautions. I wipe down the truck all the time, I spray it, and basically just try to do my part in keeping it clean. And also keeping myself clean, proper hand hygiene, clean uniform, everything, because we are dealing with sick patients, so obviously I don't want to be another source of infection for the patients as well. So it's kind of a two-way street. Now most importantly, the last thing I want to talk about tonight is tips and tricks for how to deal with side effects of the TKI. So for me, a lot of the side effects were joint pain, some muscle, bone pain. Occasionally I would retain some fluid in my ankles, but it was never serious. And I would bruise a little bit more easily. So what I did for these symptoms, and occasionally I would get some nausea too, some stomach issues, but I have a very high pain tolerance, and I can deal with side effects pretty well, so I was able to treat them conservatively with home remedies. So for the muscle and joint pain, I would take Epsom salt baths. Those were the best things. It was relaxing, and not only did it help my joints, but it kind of helped my mental state, because it forced me to just kind of relax and just kind of be with myself and really check in with my own body. So that was one big remedy. One big tip: because the chemotherapy does make you bleed and bruise more easily, it is not advised to take Advil, aspirin, or anything that can increase your chances of bleeding. So I always took Tylenol. I would try not to if I really could help it, but if I really needed it, I was having a bad pain day, I would take the Tylenol. Now, a drawback with the Tylenol that the Advil has and it doesn't is that the Advil is an anti-inflammatory, whereas Tylenol simply just helps with the pain. So in that case, that's where the Epsom salt comes in, or you can use icing or, hot pads, and more conservative measures, non-medicinal, to kind of help with the inflammation. And just listen to your body. If you're having a bad pain day, it's okay to stay home and just relax and just do what your body is telling you to do. Just take a break, and whatever you need to do can wait. Your body is the most important thing. Your health is the most important thing. And by taking care of yourself, that's the best thing you can do. For the nausea and everything, I never really had it terribly bad. Personally, I don't do fried food that well, even without the chemo. So if my stomach was bothering me, I would stay with a very bland diet. So I would eat kind of crackers or toast, maybe eggs, and try to drink maybe water and ginger ale or tea. Which, fun fact, with the chemo, I know for Sprycel at least, I don't know about any of the other TKIs, you can't have chamomile tea. So that was a big downer for me because I loved sleepy time tea. It was really calming and helped me go to bed, but it's one of the smaller drawbacks for, the medication taking away your CML. So essentially it wasn't that big of a deal. Another thing that you can't have while on Sprycel, at least, is blueberry pomegranate juice, or any form of pomegranate, which is my favorite juice in the whole world, so I'm really disappointed about that if I have to go back on chemo. So I stocked up on it. I'm going to drink it until I have to go back on the meds and just enjoy it. But there's that, and then grapefruit byproducts and the actual fruit you can't have. And interestingly enough, I don't remember where I read it, and my doctors actually weren't really aware of this, but you're not supposed to have dairy within, I think, an hour before and an hour after taking Sprycel. Fortunately for me, it never really changed anything. I think maybe a year or so ago I had one blip in my lab work that we kind of brushed it off, maybe because I was having ice cream here and there after taking my meds. But, since then I've stopped doing that, and I don't really notice a difference, but that is an interesting fact. Now, somebody asked me this morning, when do I suggest taking your TKI? Personally, I took it at night, because if I was going to have any nausea, or possibly vomiting or any other side effects that would kind of interfere with my daily activities. At least I was going to be home, at least I was going to be like in bed, and I didn't have to worry about getting up and having to go to school or something else. So I choose to take medications at night just because I don't know how it's going to affect me, and at least I know I'm home, my parents are home, so God forbid something goes wrong, you know, I'm in the best place that I can be to deal with it. Thank you, Grace. I see your comment that with Gleevec you can't do dairy, so that's good to know. Thank you. So that's pretty much all the questions I had this week. I'll try to think of more for Sprycel. Personally, I didn't have that tough time with it. The side effects are very minimal, but I'm hoping that if I have to go back on this time around, I'm still lucky and I don't have that many side effects, and I can kind of pick up where I left off with the home remedies and get my PCR back down and undetected. So I'll keep you guys posted. I'll definitely have an update with the nerve conduction study this week, and hopefully we'll have a game plan from there. Just want to say thank you. This is actually the most live viewers I've had at once. I think I have about 6 people watching. That's pretty awesome. And this week was great. I got 5 new members to my personal group, and for the private group for caretakers, adolescents, and pediatrics, I got 4 new members, so that's awesome. Yes, Willie, Gleevec is a different type of med. It is the first generation of the TKI. I guess I'll explain further. So, when I was first diagnosed, I was kind of actually pretty elevated. I wouldn't say I was borderline accelerated, but I was high enough to the point where they decided to go with Sprycel, because even though the side effects were a little bit more potent, I was going to get a quicker response, which I did. So, at the time that I was diagnosed, the only 2 generations that were available were Gleevec and Sprycel. So, because I skipped over the first generation, God forbid I have an issue with the Sprycel or I stop responding, it's not like I can go back to the previous generation, which was kind of a drawback of choosing Sprycel, but at the same time, it ended up working in my favor as I got a rapid response. So, if I don't respond to the Sprycel, the next step would be going to the 3rd generation, which is to Cigna. So, I think that kind of answers that. So, I like this a lot. Thanks for the questions. I was diagnosed... Grace, thank you for your question. I was diagnosed when I was 19. This was in 2017. Thanks so much, Janice, for the comment. I like this. Actually, this is ultimately my goal, to have live questions and me answer. I think that's awesome. So, if you guys have more questions, I'm more than happy to stay on, but if not, then spread the word, because I would love to do this. This is really cool. And I hope you guys don't mind me shouting out. Nice. Alright, so if anybody has any other questions, feel free to type them. If not, then I'll try to think of new things to do for next week. I'm kind of running out of ideas because, you know, I've talked about the main things. I was diagnosed in June of 2017. I'm sorry, no. Yes, actually, yes, that's right. I'm sorry. June 2017. I was 19. I had just come out of treatment for my eating disorder, and I was having issues. I had pneumonia, so I finally went to see a doctor and went to Sloan in June. I think the exact date was actually like June 7th, something like that. So I'm actually coming up on my 4-year cancerversary. Woo. And hopefully the beginning to another term in molecular remission. So, thanks again, guys. This was really awesome. I do want to do like a live Q&A at some point, so spread the word, and maybe that will happen sooner than later. So, thanks for watching, everybody, and keep doing what you think you can't do. Bye.